All right, here we go. All right, I want to welcome everybody and thank you for joining us for this event. We have a special lineup for everybody and some great guest speakers. I think you'll be really excited to hear from everybody. And as you know, if you're attending, hopefully this webinar is to address certain issues revolving around admissions for applicants that may be LGBT identifying students. And since getting admitted to medical school is daunting already, this may seem especially daunting for LGBT students. And this isn't a topic that's talked about a lot. So I've gotten a lot of really good feedback about this webinar, and I'm really excited to have these excellent speakers with us today and to be sharing their thoughts and their point of views on this topic. So to introduce the speakers here, we have from NYU School of Medicine, we have Chelsey Fullerton. She actually works in the diversity office. And then we also have a couple speakers from Ohio University Heritage College of Osteopathic Medicine, Dr. John Schreiner and Jill Hartman. They both work in the admissions office. And so we do have a student also from OUHCOM who will be sharing a bit about his experience regarding this topic as well. So let's get started here. And first off, we will have Jill and Dr. Schreiner share about OUHCOM and their admissions and how their school works in handling applicants.
Okay, so we just need the desktop, and I'll
Okay.
All right. Now I'm the host. Okay. So what we thought we would do, a lot of admissions is similar between MD schools and DO schools, but what we thought we would do is kind of talk a little bit about osteopathic medicine and what it is first, because some people still don't know about DOs and osteopathic medicine. So that's where we wanted to start tonight. So we're just going to do a really brief history and philosophy of osteopathic medicine. So probably the main things you need to know is osteopathic medicine is a very uniquely American form of medicine. It was created by Dr. Andrew Taylor Still, and he created this philosophy of medicine due to a family tragedy. He had 6 children, and 2 of his 6 children died from spinal meningitis. And it really kind of led him down a path of thinking there's got to be a better way to treat people. So in 1874, as you can see, he became the first practicing DO in the United States. He created the first osteopathic medical school in Kirksville, Missouri in 1892, and now, 140-some years later, there are 30 schools of osteopathic medicine in the nation. Most of them are private schools, but there are 6 public schools where we're at. They're in Ohio at OUHCOM. We are a public school. And you'll also see by this slide that there are actually 40 locations. So 30 schools, 40 actual locations covering 28 states, and there are more schools kind of in the pipeline. I know there's going to be one opening up in Arkansas next year, something like that. So osteopathic medicine is definitely growing. But a little bit more about what it is. This philosophy of medicine is based on 4 tenets, and these are the 4 main points that Dr. Still believed. And so his main point was that the body functions as a single unit or as a whole. So sometimes you hear osteopathic medicine referred to as a holistic approach to care. Basically just means we're taking into consideration mind, body, and spirit when we're working with patients. Dr. Still believed that the body's structure and function are interrelated, and then very closely tied to that, he believed the body has an intrinsic ability to heal itself. When you kind of mash basically points 2 and 3 together, you get the real essence of the distinctiveness of osteopathic medicine, and that lies in a treatment called osteopathic manipulative medicine, a skill that only DOs learn. And the final tenet for Dr. Still was he believed disease is an effect and not a cause. basically what that means, what it boils down to, is your job as an osteopathic physician is to find the cause of the problem, not just to treat the symptoms. So if somebody comes into you and they have lower back pain, you may not look at the lower back for the very first, evaluation. You might ask some questions. You're going to listen to what your patient tells you. You might actually start at the feet to do kind of a measure of gait. So just because the back hurts, that doesn't mean that's the first place you're going to go. And so that's kind of how we look at the patients. We look at everybody as a whole. We take everything into consideration. So again, you might be thinking, okay, so why? Why does osteopathic medicine exist? Well, basically, when you think back in the time when doctors still practiced, we were post-Civil War. Our medical technology wasn't very advanced back then, and a lot of the practices were doing more harm than good. So some of these treatments that you can see there, we're not doing those anymore, not doing so much bloodletting these days. We're not giving mercury for anything anymore, but we were doing that back then in the late 1800s, for conditions such as trying to stop diarrhea. So it's kind of a good thing that somebody thought, maybe there's a better way to do this. So when people want to know the difference between DOs and MDs, we always like to say there are basically two differences. One is the very tangible osteopathic manipulative medicine, that hands-on skill where, again, you're learning how the body's structure and function are interrelated, and basically what you're doing is getting the body back into a place where it can begin to heal itself. So you're adjusting the structure so the body can function better. And then the other difference is just kind of that philosophical whole person approach to care. We are going to prescribe medicine, we are going to do surgery, but you're going to, again, look throughout the whole body, consider the whole person, and really kind of focus on that instead of, okay, here's the disease, I just need to treat this disease. You're going to be treating the person. And of course, just the sheer numbers.
That's good. Just to add briefly, this Dr. Schreiner, that in terms of the philosophical approach, really the crux is a real patient-centered approach to delivery of care and treating the patient. As Jill mentioned, that holistic approach, looking at maybe one's gender, one's life stage, one's stressors in one's life, socioeconomic situation, one's home situation, one's occupation, one's home environment, things as one's culture, maybe one's sexual orientation, things such as one's psychological well-being, maybe one's spirituality. As you said, that mind, body, spirit, looking at everything, all the internal and external influences that might be linked to that patient's compromise is really what the physician, the osteopathic physician, wants to do so they can arrive at the most accurate diagnosis and then prescribe the most prescriptive course of action to enhance the greatest outcome.
All right. So you might be thinking, do I know DOs? Have I seen DOs? Chances are you probably do know a DO, but maybe you don't know it. You are going to find them in all specialties and subspecialties of medicine. In fact, Dr. Still was actually a Civil War surgeon, but he really believed that primary care was the foundation of medicine. So you do see a lot of DOs heading into the primary care fields of family medicine, general internal medicine, and general pediatrics. But no limits to that. You're certainly going to find DO cardiothoracic surgeons, DO emergency medicine physicians, I don't know, name your specialty, and there's a DO out there in it. Excuse me. So you're going to find DOs in all 50 states, and you're going to find them internationally as well. And probably most important, this is probably where you don't realize you're seeing a lot of DOs. You're seeing a lot of DOs do research and shaping healthcare policy in our nation. So if you are thinking about an osteopathic school, the good news is DO schools and MD schools look for a lot of the same things. So, we want you to have that 4-year degree. For our school in particular, you do need to be a U.S. citizen or hold a permanent visa. Most all medical schools are going to require just these basic requirements, but some of you know if you're preparing for the MCAT, some schools are requiring maybe biochemistry. Not a bad thing to have. So these are general, but they're also kind of our particular requirements. You do have to take that medical college admission test, and then all schools have their health and technical standards. It's a document that you would need to read, agree to, and sign either prior to matriculation or right after you matriculate. Now, here's where it gets a little fun for those thinking of applying. There are two separate application services. There's AMCAS for the MD schools, but the DO schools use a service called OUHCOM. And you'll see that acronym there. That stands for the American Association of Colleges of Osteopathic Medicine Application Service. Hence the acronym. It's kind of a mouthful. But the timelines are pretty much the same as the MD schools. Things open up in May. You can actually click the submit button in June. Earlier in the year, it doesn't take quite 4 weeks, but the later on, if you wait later in the year, it's going to take at least 4 to 6 weeks to process an application. We do require essays. You're going to have to send your transcripts to the application service. You do have to have the MCAT score submitted to OUHCOM directly. You can kind of see the costs are, I think, roughly comparable to MD schools, but you can also see that there are fee waivers available. So it's kind of a parallel process, but there is a separate application service for DO schools, and the MD and the DO application services do not talk to each other. So we don't know if you've applied to MD schools, and MDs don't know if you've applied to DO schools. And I believe, some other things that we look for. Again, all medical schools are looking for the same things, and I'm not going to read down through all these. But basically, we are looking for diversity in our classes, and diversity isn't just, ethnic diversity. Again, just kind of reading down through those. Anything you want to add to that?
Yeah, one of the things, I know that the AAMC had come out with their holistic approach to medical school admissions about 5 or 6 years ago. We're quite pleased to see that, because that's always been the practice, certainly of OUHCOM, but especially osteopathic medicine, as we embrace the diversity that really is our applicant pool. As Joe mentioned, diversity is not just race and ethnicity. It could be issues such as non-traditional students, folks from different socioeconomic environments, sexual orientation, like I said, career changers, people coming from non-traditional pathways, not the traditional biology or chemistry or hard science pathways. So diversity is many different things, and that's what creates a dynamic learning environment. So we're looking for everything in a candidate.
Okay, and so this is our last slide. We just wanted to show some helpful resources if you are interested in learning more about osteopathic medicine. There is the American Osteopathic Association. That site is nice because you can actually search for DOs. You can search by specialty, you can search by state. So if you're wondering, where are the DOs in my state, that's a good place to start. You can also go to the American Association of Colleges of Osteopathic Medicine, and we have the listing for our Ohio Osteopathic Association, but every state in the nation has their own osteopathic association. So wherever you're currently residing, just do a Google search for that state's osteopathic association, and I'm sure the people who are there would help you learn more about osteopathic medicine as well. So that's it for our slides. Let me try to get back here where I can hopefully successfully pass the controls back to somebody. There we go. You don't have the controls back yet, do you, Corey?
I do, thank you. Oh wait, I think I do. This is tricky. Okay, just so you know, we weren't able to see your slides during that presentation, so hopefully maybe we can share them via email to the attendees afterwards, or we can get them that in some way.
Apologies for that. Oh, so you just got to look at a blank screen for 10 minutes. Sorry.
So we got to hear everything. So that's good. Let's see. Can you make Chelsey the host now, or?
I will try. Let me see if it will. Well, it let me a little bit ago. So let's see if I can. Well. This worked when we practiced it. Apologies, I'm having difficulty doing that.
Okay.
And it should be as simple as me clicking share my desktop and then being able to pass the controls. Wait a minute. I wonder if I can do it.
Okay, I think I got it.
Okay. There you go.
All right, Chelsey, come to you.
Great. Thank you, Corey. And hi, can everyone hear me all right? Can I just get a verbal yeah from some of my fellow panelists?
Yes.
Yes.
Wonderful. Thank you. I'm going to take a stab at sharing, and it looks like I don't actually have the option to share my desktop for some reason. Corey, any thoughts on that? Oh, there we go. So now I've got away, so I'll just take a moment to put up my slides. And can folks see these?
Oh, yes.
Okay, perfect. So hi, everyone. My name is Chelsey Fullerton. I work at NYU School of Medicine in the Office of Diversity Affairs, and I want to thank folks for all of your great questions, both leading up to the webinar as well as the questions that are coming in right now. I promise that as soon as I am done speaking briefly with you about NYU and LGBT life at NYU, I will answer the questions to the best of my ability. I will also have my email address at the end of this presentation in case folks want to reach out and ask more questions that you didn't get to on the webinar. So I want to speak very briefly about NYU in general, just to give you a sense of our institution. So our mission here at NYU School of Medicine is to enroll a diverse group of academically talented students. We're seeking to build future leaders and scholars in medicine. And though the Office of Diversity Affairs is not the Office of Admissions, we work very closely with our admissions office. And we and the admissions committee do embrace a broad definition of diversity, and we use a holistic approach to evaluate our students' applications. And we value a variety of things. It's not just your raw scores and your academics. It's also the interpersonal skills that you display, your leadership potential based on your involvement and your experiences. And so ultimately, we want to build a rich, diverse student body that has a desire to improve the health of all populations. And this is going to tie back very much to LGBTQ health in a moment. At NYU, we are very consistently ranked in the top 20 of all medical schools by U.S. News and World Report. We were in this past recent announcement of the rankings. And in terms of what sets us apart as an institution, we have a flexible curriculum. And so at NYU, we have 3-year, 4-year, and 5-year MD pathways, as well as several different dual degree programs that you can finish in either 4 or 5 years, including an MBA in Business Administration, an MPH in Global Health, an MPA in Health Policy, and Masters of Science in Clinical Investigation, and a Masters of Arts in Bioethics. So there are lots of options to really make your degree and your time in medical school as beneficial as possible. Our main campus is a rich place to learn to practice medicine. So we have, as part of our training grounds, Bellevue Hospital, which is the oldest public hospital in the nation, founded in the 1730s, and it serves a wide variety of many, many different diverse patients here in New York City. And you'll see here on the slide a picture of the inside of the institution. It has so much history and really serves such a wide range of patients who speak many different languages and come from all sorts of backgrounds in New York. We also have Tisch Hospital, which is our private hospital and has many, many different world-class providers and specialties represented there. We also have the VA, and so as a student here, you'll get to experience what it's like to practice medicine at a public institution, a private institution, and a VA hospital. We also have many other institutions where our students can learn about medicine as well as different types of medicine, including an Institute for Rehabilitation Medicine and a hospital for joint diseases. In terms of our commitment to LGBTQ inclusion, we do include enter non-discrimination policy, sexual orientation, gender identity, and expression, but I think that we like to also take many steps further than that. So we're not just reactive in the ways that we want to protect folks who are LGBTQ, both patients, employees, and students, but we also have some proactive ways that we demonstrate that commitment. So both Tisch Hospital and Bellevue Hospital have LGBT advisory councils that are made up of students, staff, and at times even patients that discuss the quality of LGBT patient care at the institution and seek to advocate for change. And one of their major initiatives has been to ensure that both Tisch Hospital and Bellevue Hospital have what's called the Healthcare Equality Index, or the HEI designation, and that's something that HRC Human Rights Campaign certifies hospitals and community health centers in. And we're very proud to say that both Bellevue and Tisch are designated as a leader in LGBT health equality. For Tisch, it's been the past 3 years, and Bellevue just got its first designation this year. So as a medical student at NYU School of Medicine, there are many opportunities that you'll have in LGBTQ health, both curricular and research and in professional development. In terms of curriculum, the Office of Diversity Affairs has 2 primary selective and elective courses that you can take as a medical student to delve deeper into LGBT health. Those 2 courses are Gender and Health, which focuses on men's health, women's health, and LGBT health, as well as a course that focuses on health disparities in general. So these courses give you opportunities as a medical student to learn about LGBT health and health disparities, as well as to experience it in clinic and to interact with a diverse number of faculty members and folks who work in the New York City community through that process. We also have, through the Office of Diversity Affairs, numerous opportunities to participate in LGBT health research. We sponsor a couple of students each year in a health disparities research fellowship where they can engage in all different types of research about LGBT health. And we also maintain a research mentor directory that you can find on our website, or you can find by just searching NYU School of Medicine Research Mentor Directory that has a list of the many faculty members that we work with, from pediatrics to OBGYN to surgery, who do research in health disparities, and it also lists the populations on which they do that research. We're also committed to professional development and have a strong showing of students as well as faculty and staff at the annual GLMA Health Professionals Advancing LGBT Equality Conference. In fact, we were there just a couple of weeks ago in Baltimore presenting on some work we've done in educating medical students about how to care for transgender patients. In terms of co-curricular opportunities, there are many different ways to interact with LGBT life as a student at NYU School of Medicine. One primary way is through our LGBT People in Medicine student group that's been around for about a decade now, and that works with the Office of Diversity Affairs very closely and ensuring that NYU School of Medicine's student body is both a safe and inclusive place for LGBT students, as well as they do a lot of work in ensuring that their peers are educated in how to best care for LGBT patients. The Office of Diversity Affairs also manages an LGBT ally Safe Zone training called Safe Zone Med that we offer to all students as well as anyone affiliated with NYU Langone Medical Center. This is a training that teaches basic terminology as well as some content on health disparities and wraps up with some practical action items that folks can use to be a better ally to LGBTQ people. We also maintain an out list, which is a list that's again located on our website, or you can search NYU School of Medicine out list that lists folks who are affiliated with NYU School of Medicine who want to be identified as out, as LGBT. On that list, you'll find current students as well as faculty members, as well as nurses and PAs and staff and administrators. All these folks choose to be listed so that they can be a resource for both current and prospective members of our NYU School of Medicine community. And so I encourage you all to look at that list. And if I'm not able to answer all your questions, I hope that you'll reach out to someone on that list who might be able to. We also collaborate quite frequently with the NYU LGBTQ Student Center, which is located on NYU's main campus. You'll see here there's a small slide listing just some of their groups, one of which is Queer Grads, that many of our medical students are involved with that allows them to interact with other LGBT-identified graduate students at NYU, including law students and students who are pursuing their MBA, students who are pursuing their MSW, as well as a variety of other disciplines. All of these opportunities really give a robust sense of what it's like to be LGBT here at NYU and in New York City. But I wanted to focus specifically on some of the questions that were coming up from you all about How do you approach the application process to medical school as an LGBTQ person? And I think that for me, when I'm advising prospective students on these issues, there are no right or wrong answers. And I think it really sums up to what are your answers to some of these questions. The first and primary question that you all must ask yourselves as LGBTQ applicants is, what do you value? What do you value as an applicant? Do you value coming and letting this piece of yourself, your sexuality, your gender identity, or your gender expression, do you value that being a visible part of your application? You also must think about, what do you value as a medical student? So if you plan to be a medical student who's active in LGBTQ life at your institution, you're going to want to think about, what will that look like during your interview and during your application process. It's also good to get a sense of what the institution to which you are applying values, and there are some ways you can get clues about that. You can look at the mission of the institution. You can look at their policies. You can see if they have a diversity, a multicultural, etc. type of office that includes sexual orientation, gender identity, and gender expression in their mission statement. You can also see if they have an LGBTQ student group. And all of these are folks who you could reach out to as an applicant to get a better sense of the culture and climate there. I encourage you all to research the school to which you're applying and reach out to someone in their diversity office or in their LGBTQ student group to get a better sense of how out and to what degree you want to be out during your admissions process. I think it's also important to note that some of us within the LGBTQ community have different degrees to which we can decide to be out. For some of us, it's not so much as a choice. We're already out because of the way that people perceive us, whereas some of us have more agency in that decision. So that's important to keep in mind as well, but these are still good questions for reflection as you're figuring out what's going to work for you individually. In terms of how to be prepared to respond to questions, I know we had a lot of folks who are asking, is it illegal to ask questions about sexuality or gender identity in your interview? What do I do if people ask me these questions? The answer is that right now there are no federal protections that make this an illegal question to ask federally. That doesn't mean that the individual states to which you're applying might have some sort of restrictions or regulations against asking questions about this. And that also doesn't change the fact that these are still inappropriate questions for interviews to ask you, but you do want to have a sense of how you will respond if you're asked that question, whether that response is, that's not a question I'll answer, or if that response is that you're going to disclose something about yourself. Whatever is going to work for you, it'll be important that you have that process worked out internally. In terms of how out you want to be as an LGBTQ applicant, I think sometimes we can get the sense that this is a dichotomy, that we're either out or we're not. And it's important to note that there are varying degrees of how much you want to disclose, as well as how and when. And it's up to you as the applicant to decide what is high risk for you and what is low risk, and what's the level of the risk that you want to take. So some examples of how much you could disclose could be as simple as being involved, maybe as an undergraduate student in an LGBTQ student group. Could be that you have an interest in LGBTQ health. You could disclose your identity in general, so perhaps you say, as someone who identifies as part of the LGBT community. You could disclose your identity specifically, so you could say, as a bisexual person, or as a lesbian, or as a transgender woman. Or you could even go so far as to tell your personal story of coming out, or a personal story that's relevant to you in your LGBTQ identities. None of these are right and none of these are wrong. It really is up to you, and you get to sort of decide how much of these stories you want to tell and to what degree. You also get to decide how and when you want to disclose this information, and you have a variety of options there as well. For some folks, they choose to disclose in their personal statement that goes through AMCAS to every school to which they apply. Some folks may choose to just disclose in their secondary application, so they can pick and choose which institutions they want to know this information. Some folks may choose to disclose somewhere on their CV. For example, you may have on your CV, if you choose to include it, that you were involved in an LGBT student group. That may also be something that you have in your involvement or your experience. And you also have the option of disclosing during your interview. Now, at NYU School of Medicine, we believe that diversity is a valued part of all of our applicants, and we include sexuality, gender identity, and gender expression in that diversity. And so for us, we encourage our applicants to express themselves in whatever ways feel right to them, and we see value in applicants who seek to serve a diverse patient population, including those who are LGBT. Now, that's our perspective at NYU. I can't speak for every institution, but I do know that we really value seeing applicants show that they are passionate about LGBT health and passionate about serving the LGBT community. I also will say that at NYU School of Medicine, our interview process is designed to be less biased than perhaps traditional interview formats might be. We use what's called the MMI, the multiple mini interview, where you interact with at least 6 to 8 separate interviewers and many, almost speed dating interview sessions during your interview day. And I think this is also valuable, particularly for LGBT applicants, because bias and discrimination do still exist. These are things that we don't want to be in our process, but they still exist in our society in some way, right? And so we want to make sure that if you happen to be in a room with an interviewer who for whatever reason you're not clicking with, or perhaps they are biased or they are being discriminatory, we know that through this MMI process, that's just one interview that you have, and you have multiple others that all factor into your score. And so that may be something that you all want to keep in mind as applicants, that as you're looking into schools, which ones have the traditional interview process and which ones have the MMI? So these are all questions to think about. So that's all that I'll say at this point. I'll leave for just a moment both my email address, it's chelsey.fullerton@nyumc.org, as well as my phone number, our website, and our Facebook page. I'm definitely available if anyone has questions, and I hope that some of these questions that I pose to you are good food for thought as you're going through your application process.
All right. Thank you, Chelsey. Okay, thank you, Chelsey. And next, we will have Joshua Jamison, who is a student at OUHCOM, share a little bit about his experience in his dealing with getting admitted into medical school.
Can you hear me?
Yep.
Okay, great. Well, I want to thank you all again for tuning in tonight. It's a great opportunity for you to get a very intimate idea about how to apply to medical school, both from the perspective of the admissions team as well as from somebody who was in your shoes not but years ago. Again, I want to, Chelsey said, approach to applying to medical school and disclosing your sexuality is a very individualized approach, and I'm going to share my experience, but again, my experience is my own, and maybe it'll be right for everybody listening tonight. Like many of you listening today, I struggle deeply with the decision to disclose sexuality, specifically the personal content section of my medical school application. And in making this decision, I spoke with a number of people, both current medical students as well as my physician mentors, and as I'm sure you have, I got mixed advice. Some of these people said that I should disclose this information, their rationale being that my history of LGBT activism would make me a better physician in the future, while other people said that it may hurt my chances getting accepted due to discrimination, and they advised against it. However, I will say that in the end, I did in fact come out as a gay man in my personal comments, and I would like to tell you why I chose to do so. At the age of 17, I participated in a diversity training panel for newly recruited police officers in my hometown of Cincinnati, Ohio. This training was required for all new police recruits, and it was an attempt to increase sensitivity to various minority populations, namely African Americans and members of the LGBT community. During this discussion, I, along with many of my panel members, narrated our coming out experiences. And this, for me, was such a profound event, and it impacted many of the activities that I participated in, both during college, as well as my time off between undergraduate and graduate school. And because this experience was so important to me, I felt it important to include it in my personal comments, and of course, in this process, outed myself. Now, the reason I mentioned this to you is I think it brings up an important point. If you choose to discuss your sexuality or your gender identity within your personal comments, I think it's important that you make sure there's a reason for doing so. I think this is true for everything you include in your personal comments essay. Nobody wants to read a beautifully constructed personal statement and then find at the end a disjointed mention of your sexual orientation. And the reason I mention this is because I think it's very important to get across to those reading our essays, especially folks who are not a part of the LGBT community, is that this aspect of our lives oftentimes contributes to our resilience, our understanding, and our compassion, all of which I think are important aspects of a good physician. Now to bring it back to my interview experience, and I'll quickly mention the interview at OUHCOM is a traditional interview. It, at least in my case, was 3 interviewers, each about 10 to 15 minutes each, if I recall correctly. And I interviewed at a number of schools, both MD and DO schools, and only one school acknowledged this aspect of my personal comments, and that was here at Ohio University. The first interview, the gentleman I sat with said that he both enjoyed reading my essay and thanked me for my honesty about my sexual orientation. And the second interviewer, who was more interested in my LGBT activism, also asked me if I would discuss these experiences in greater detail, and we had a nice discussion about that. And I want to say that I chose to attend OU for a number of reasons, but I have to say that my ability to be open about my true self within my interview and my personal comments was very important to me. And so I will say for my that disclosing my sexuality, both in my application and my interview, I think helped me choose the proper medical school for me. And with that, I will turn it back to Corey, and I'm happy to answer any questions you have.
Okay, great. Thank you for sharing, Joshua. Now we can open it up for discussions and questions. So if all the panelists can unmute themselves, and we can get started here. We had a bunch of questions come in during when you all were RSVPing for this event. So I'd just like to go down the list there, starting with, do you have a preferred name area on the application?
We don't, excuse me, this is Jill from OU. Only on our bio sheet that you get when you interview do we ask for a preferred name.
Hi, this is Chelsey at NYU, and currently all of our information for our applicants and our interviewees is completely populated by AMCAS. And as you all know, AMCAS does not collect information about sexuality. It also only has a binary gender option, though you do have the opportunity to say do not disclose, and it does not have a preferred name box. And so I can speak with anyone who has more in-depth questions about what filling out certain elements on AMCAS will mean, what implications it will have for financial aid. But I will say that if you have a preferred name that you would like to be used during your interview day, that's something that at least at NYU, we would want you to reach out and let us know about. Also in the same way, if perhaps the gender that you're marking on AMCAS would be correlated with an honorific like Mr. or Ms. that you don't want used for yourself, that's another thing that you'd want to reach out to schools where you've got an interview and let them know about that so that it doesn't result in any uncomfortable situations during your interview. I recognize that this also means outing yourself inadvertently to folks, but I do know that at NYU, because we're limited in terms of what AMCAS gives us for now, we appreciate and value folks reaching out to us and correcting, at least in our databases, name as well as gender and pronouns, if that answers the question.
Okay, great. Thank you. Josh, did you have anything to add into that question?
I recall that on my application, but I think the admission folks would know better than I do.
Okay, excellent. And if you all have any questions that may come up while we're going through these questions, please feel free to type them in the chat or the Q&A section, and hopefully that they can get answered for you by the end of the session tonight. So our next question is going to be, how does an applicant's private sexuality play into the admission process?
Well, this is Dr. Chronicle. You know, I don't know that it really plays into the decision-making process necessarily in terms of any adverse sort of implication, especially here at OUHCOM. As we mentioned, you know, we're looking for a diverse student population to treat a very diverse patient population. And we really believe that, you know, we want to kind of create the mosaic of diversity in our student population that does reflect society. And you know, that is diversity in terms of ethnicity, race, culture, sexual orientation, and everything that you might think is embraced under the broad umbrella of diversity. So should it play a part in decision-making? Possibly, yes, in terms of what it can add for your student body and down the road how it might close disparities in healthcare. But in terms of any negative implication, it has no place in decision-making.
This is Chelsey, and I will add that though we're living in a world that's changing, things like bias and discrimination certainly do still exist. So I think that as an applicant, you have to think about what sorts of things are valuable to you. And I do think that for many of us within LGBT communities, our sexuality isn't just something that's private, right? It has to do with our families, it has to do with our identity, it has to do with our community. So though for some folks maybe listening to the webinar, it might be something private that you choose not to disclose. For some folks, it may be much more than that, right? It may be a larger piece of who you are and what your identity is. And neither option is wrong, right? It all really depends on how much you feel is important for your institution to know, and then how out you choose to be while you're at that institution.
Yeah, I would like to, again, mirror what Chelsey said. For me, it was a big part of my life. It was my family. It was my partner. It was everything. It was who I am. So for me, I needed to express that to my medical school, and I think it was important that the medical school that chose me was the right place, and that meant them knowing this very important aspect of who I am. So again, I can't speak for everybody, but in my case, that was how it played.
Great, thank you. Our next question is going to be, should I include my identity in my personal statement, or when and how should I bring it up?
I guess I can answer that. I think the personal statement is perhaps the best place to talk about your sexuality or your gender identity. I think it's maybe the only place in the primary application that you can mention that. However, I would say if you do mention it in your personal comments, I think you need to make sure you're comfortable talking about it within an interview setting, because I can't imagine an interviewer asking somebody their sexual orientation without them mentioning it within their personal comments. So if you do write it in your personal comments, I think you should be comfortable enough with that aspect of yourself to where you feel comfortable talking about it face-to-face with someone that may ask you a question.
Okay, did any of the other panelists want to add to that question?
I think Joshua's comments were right on the mark, and I think Chelsey also indicated too, it's really what you're most comfortable with, because if you include it in your essay, then it is open for discussion, and you really need to have that level of comfort to be able to address that aspect of your individuality and who you are. If maybe you're not as comfortable at that point, or if you have some fear of maybe this might be the impediment to your getting a secondary or getting an interview, maybe you hold off. But I think that it really comes down, and I think, Chelsey, you articulated it quite well, to research the institutions that you'll be comfortable with, and that are really truly embracing what diversity is about. So I think doing your homework and really having that reflection of your comfort level are two important aspects as you move forward with this.
Yeah, I'll echo that as well. And I think that one thing I've seen as in my dealings with the admissions process, both as a screener and as an interviewer, that you do have options as an applicant if you choose not to be out on your main application. And so those are some of the things I went through previously. Perhaps you choose to be out on a question on a secondary application. In our secondary application, for example, we have a question that asks more or less, what ways will you contribute to the diversity of our community here at NYU? And that's a question that we intentionally designed to be an open space if folks want to disclose something like their sexuality or gender identity in the application. I'll also see folks who choose to bring it up in one of their interview sessions, even if it's not in their application, because they wanted to get a sense and sort of feel out what the institution was like before they got an interview. And so I think it's important to know as well that if you are not out on your statement for whatever reason, you have other options if you choose to come out later in the process. I do want to say that one person has brought up just another way that perhaps you could be out or be outed, particularly as a trans applicant to medical school, and that is through health forms. And I think that this brings up an important point about student records that is important to note as well. So many medical schools are still going to have just a binary gender option on both their health forms and their records. And so that's something to keep in mind as a trans applicant to figure out how you want to navigate that. And it's completely critical that you find someone within the institution who can help you navigate some of those complicated processes, both as an applicant and as a matriculating student. And so I encourage you all to reach out. If you have questions, I'm happy to help navigate that process with you, or definitely reach out to someone in that institution's diversity or multicultural office who can help you sort of work through some of those things. Excellent,
thank you. And our next question is, as far as appearance, can I dress masculinely as a female?
I think the short answer is yes. I mean, I don't know who asked the question, but does that mean can you wear pants instead of a skirt? Certainly. Yeah. I'd say as long as it's conservative and professional, it's fine.
If this was one that was submitted as within the RFCP, so I'm assuming they were referring to like a pantsuit versus maybe I don't know, a standard dress or a skirt or something along those lines.
Like I said, I've interviewed at a number of institutions, and I think within every interview there were women who dressed with pantsuits, who dressed quote unquote more masculine, and I think they looked perfectly professional. I don't think anyone thought twice about it. So that's my perspective. But I would say, sure, you can, as long as you look professional. I don't think people pay much attention.
I've spoken a little with the person who originally answered this, asked this question on the chat, but my philosophy is that if you have a way where you feel comfortable expressing yourself and being out in the world, I think that that's the way that most folks are going to feel most comfortable expressing themselves in their interview. Now, that doesn't go for everyone, of course, but that's something to think about as an applicant is you want to show up to your interview feeling really confident and feeling really ready to impress. And if you're going to feel the most comfortable and ready to impress and the most confident in the types of clothes that you wear every day, then those are the types of clothes that I believe you'll want to wear to your interview. And that's something that I know at NYU School of Medicine we would value and welcome, is for folks to show up wearing, of course, clothing that's professional, but clothing that fits who you are as well, because we want folks to be individuals, right? We want you to feel like you can express yourself in the ways that make sense to you.
Okay, and moving right along, let's see. As an applicant, is it better to refrain from answering questions related to one's sexual orientation or gender, just as you would with diseases and disabilities, to prevent the admissions committee into committing discrimination violations?
Well, certainly, it's Dr. Schreiner from OUHCOM. Certainly, one's not allowed to ask about any diseases or disabilities or such under the ADA Act, so those would, in fact, be illegal questions. And certainly, we go through extensive training of our selection committee, our interviewers here at HCOM, and we really create a heightened awareness about questions that are appropriate and those questions that are inappropriate. You know, I know Chelsey mentioned that, you know, from a federal standpoint, you know, questions about one's sexual orientation and things of that nature are not necessarily illegal, you know, whereas different states might see things differently. We feel that those are certainly inappropriate questions, actually with some legal implications here in Ohio, that our interviewers are acutely aware that that's not to be asked, as that should not be a determining factor in any decisions that might be rendered on behalf of a candidate. I guess, however, I should say, too, if somebody does disclose some sort of issue relative to health or whatnot, some sort of disease or condition, if that candidate were to disclose that, then that would open the door for maybe a follow-up question. But one can't broach that subject initially.
It may be important as well as an interviewee to do a little bit of research on the state where you're going to be going and interviewing to see what are the protections in that state. Some states include sexual orientation, but unfortunately not gender identity or expression. And there are protections for things like interviews, for professional schools, or for employment. And so going in as an aware applicant, but also as a prepared applicant, is going to make you feel more ready if you do get a question like that that could be uncomfortable. So I encourage you all, rather than to hope it doesn't happen, to think about, if it does happen, how am I going to respond? And to talk through some of that with maybe some of your mentors or with other folks who you trust and value their opinion.
Okay, great. And following up with the discrimination, following right along, we have a question about are LGBT students assumed to be fit for only certain fields of medicine?
I mean, I'm going to say no. I mean, we would never make that judgment. Most people don't even know what field they really want to go into until they get into their rotations in years 3 and 4. But no, we would never presume to say, oh, you're this, so you should go into that specialty. And you know, I'd like to hear Joshua's comments, because he's actually, you know, living this right now. So, but no, I don't think any medical school would ever try to make that determination.
Yeah, sure, Jill. So I'll share with you, I think I've always known that I wanted to go into otolaryngology, and I've worked with a lot of physicians in that field, and I've personally never heard any disparaging remarks against the LGBT community. I should say, however, that I think every specialty has its own social construct, if you will, and I think everyone should find which of those kind of social constructs fits them best, because I think that's important also in choosing a specialty. However, I think that transcends gender and sexuality, and is more an issue of your personality and other aspects of that. So that's what I have to say.
And I'll wrap us up. I know that we only have a couple of minutes remaining by saying that I believe that, in fact, being an LGBT applicant who's interested in a specialty area at NYU is a strength, because we understand and recognize that though LGBT folks do need more primary care providers, we as LGBT patients need to access all types of care, right? We need surgeons, we need endocrinologists, we need pediatricians, we need gynecologists, we need all types of care. And so if you are an applicant who has a sense of what you want to do, as an LGBT person, I can only speak from NYU, but I think that that would be a strength to have a sense of your specialty and to know that you want to go into that specialty to provide more effective care in that area to LGBT patients.
All right, excellent. So we just have a couple minutes left, but I did see a great question in the chat from Connor, and I see that it was answered or typed up by Chelsey, but I wanted to see if OUHCOM wanted to comment on this. And he typed, does anyone foresee the inclusion of data statistics on gender and sexual identity in the rating publications for medical schools?
That's interesting. That's very interesting. I think it would be very interesting. I don't know if everyone across the board would want to participate. I would hope they would. But then again, you know, a lot of the data and the methodology that goes into U.S. News and World Report, you know, some might question that to begin with, let alone adding issues relative to LGBTQ issues. So I think it'd be very interesting. I'd be curious to look at that data and see and work backwards after looking at outcomes and seeing if there's any sort of predictive value in terms of, you know, where do students, graduates go to practice that are of the LGBTQ community. It could be interesting from a curiosity standpoint, but I don't know that every school is ready to go there, but I think it'd be quite interesting. Jill, do you have any comments from the HCOM perspective as well?
No, I totally concur.
Yeah.
And I think that the broader question is, before this is incorporated into rankings, we need to actually be collecting the data, which is something that we're not doing at this point. However, the AAMC does periodic questionnaires with medical students. And for the first time this year, the questionnaire that they have, I believe, just sent out to second-year medical students does include a place for them to self-identify both gender identity beyond a binary, as well as sexual orientation. So I think it'll be really interesting to finally start to get a sense of our medical student population in terms of their sexuality and gender, so that then we can start to say, what are we going to do with this data? But I think that all of you have a role in advocating to whatever institutions you end up at for the collection of this data so that we can do more with it, so that we can track and so that we can ensure that our processes are as fair as possible for our LGBT applicants. And I do apologize for folks whose questions that we weren't able to answer via chat or via Q&A. I know that I believe I can speak for everyone on the panel that we are all available for questions via email afterward, and I believe that the organizers at AMSA will be able to provide you with our contact information if you need it. But thanks to all of you for such great questions.
All right, thank you so much. Thank you for everybody that participated in this webinar, and thank you for all the attendees that did come out. That last question was a great question, and it's actually something that AMSA is an advocate for, and I saw Chelsey posted that NYU is also an advocate for that, and in sending that to the, the AMCOMs and stuff like that. So, and just so you're aware, this webinar has been hosted by the Gender and Sex Committee within AMSA, and you're more than welcome to follow us on Facebook. We do have a Facebook page, and I can post the link in the chat box below and also send that out in an email. And we do also have a website under AMSA's main website, under the action committees. You can find us under there and see what we're all doing. And it's our goal to provide you with the best programming throughout the year and at all the conferences and stuff. So if you have any ideas, please feel free to reach out to us at any time. And with that, I guess we can close the webinar. And again, I just want to thank everybody for participating, and I hope you all have a great evening. Thanks again for coming out.
Thank you, everyone.